I want to thank Sanofi CEO Paul Hudson. Paul? Hi, Paul. I hope they have you in some order. I'll be checking.
Alphabetical, yes, but...
Okay, well, we'll do the best we can. Thank you, Paul. Great company, by the way. Novartis CEO Vas Narasimhan. Thank you very much, Vas. Great job. Genentech CEO Ashley Megaragri. Where are you, Ashley? How are you? Hi. Thank you very much. Great companies. Behringer Inc. Mine President John Michael Bors. John Michael, thank you very much. Gilead CEO Dan O'Day. Dan? Thank you, Dan. Great job. That's a good company. Bristol Myers Squibb Executive Vice President Carrie Gallman. Carrie? Thank you, Don. Thank you very much. GSK CEO Emma Wormsley. Emma? Thank you very much, Emma. Great job. Merck CEO Rob Davis. Great company. Thank you. Great company. How long have you been CEO?
Almost 5 years.
Very good. You're doing a good job. And Amgen Executive Vice President and CFO Peter Griffith. Peter? Thank you, Peter, very much. Thank you very much. You okay? Fake news. We want you to be healthy. Are you all right? The camera's not okay, but she's okay. That's more important. We have good medicine for you. If you need some medicine, one of them can take good care of it. We're also joined by Secretaries Robert F. Kennedy, Jr., Howard Lutnick, Ambassador, and really some incredible ambassadors, Administrator of the Centers for Medicare and Medicaid Services, Dr. Mehmet Oz, and the FDA Commissioner, Marty McCary. They're doing a phenomenal job. Thank you. Thank you, fellas. Good job. For decades, Americans have been forced to pay the highest prices in the world for prescription drugs by far, not just a little bit. We were like a whipping post, the United States, and it's just been 4% of the world's population. We have 4% of the world's population, and consumers pay only 13% of all prescription drugs, yet pharmaceutical companies make 75% of their profits. Think of that. So we have 4% of the population, 13% of prescription drugs, and yet the people behind me, who are wonderful people, make 75% of their profits from the American customer. So they understood that better than anybody, that we have to do something. That's why I signed an executive order instructing my administration to do everything in its power to slash prescription drug prices for Americans while getting other countries to pay more. And we don't want more. We want this fair. We want to pay the same thing. They used to blame it, remember, on research and development. And I said, well, research and development for everybody. And everybody understood it. As a result, the United Kingdom's National Health Service agreed to pay the fair share for prescription drugs for the first time in 26 years. And we expect other countries in Europe will do the same. And if they don't, we're going to put tariffs on them, and we'll get the same amount of money, plus we'll take a nice return on the money. We signed historic agreements with Pfizer, Eli Lilly, AstraZeneca, Novo Nordisk, and EMD, Serrano, to reduce prices by 300, 400, 500, 600, and even 700%, and sometimes even more than that. I remember when I had a news conference in my first term, I was the first president that reduced prices from the beginning of my term to a year, from January to December, 0.25%. And I thought it was the greatest thing, because it's the first one in 28 years. Now we're talking about numbers that are so incredible. 0.25%. Think of that. I was proud of it, because it hadn't happened in 28 where drug prices went down. Well, now you're going to see numbers that nobody would believe possible. Think of that. 500, 600, 700, 800%. Today we're building on these accomplishments. The companies assembled in this room have agreed to offer all of their drugs to Medicaid and most favored nations pricing. You're going to get most favored nations pricing, meaning they're going to pay our country the lowest price paid anywhere in the world. And they will list their most popular drugs on TrumpRx.gov. TrumpRx.gov. And I didn't name it that. Somebody named it that. And I guess they assumed that was, did you name it, Oz, or Bobby name it?
We all named it together.
Okay, well, I'm honored to have the name. And so far, that's turned out because the numbers are so incredible. It's an honor. And you're going to get massive discounts to all consumers. So massive discounts will be not even offered. It's just going to be a fact. All consumers will get massive discounts. That's TrumpRx.gov. Every new drug produced by these companies in the future will permanently be offered to American patients at most favored nation prices. You know, people used to talk about that for years, but nobody ever did anything about it. No other president did. And it wasn't easy, but it worked out great, and I'm so proud of the people behind me. As an example of the price reductions we have secured through these new agreements, Santa Fe will cut the cost of its blood thinner, Plavix, from $750 to less than $16. Wow. Where's Santa Fe? Where are you? What? That's incredible, huh? Could have gone to $17, maybe. That's amazing. And you're going to do tremendous business. You're going to do much more business. So that's coming from $750. Think of that, $750. And that's the number one blood thinner. I don't want to know about that. I take an aspirin. To less than $16. Think of that. Bristol Myers Squibb, great company, both great companies, will cut the price of HIV medication, Raytaz, from nearly $1,500, $1,500 to $217. And it will cut the cost of hepatitis B medication, Baraclude, from $1,400 to $413. Gilead will cut the hepatitis C medication, Epclusa, from nearly $25,000 to less than $2,500. And all prices are like that because we're bringing them down to the world's lowest price, everything. And these people really are pioneers. What they're doing is so great. And in the end, they're going to do much more business, and it's. I think it's going to even out for them as a company. The countries will have to pay more, but even for them, because of the fact that the world is quite a bit bigger, it won't be very severe, I hope. I also want to thank these companies and their incredible executives for their generous contribution to American national security, because it's really what it is. It's, to a large extent, national security in addition. You can't continue to pay 13, 14 times more than other countries and think you're going to have security. Collectively, they will invest over $150 billion to build up domestic pharmaceutical manufacturing in America. They're going to be, because of tariffs, they're coming in. And I think because of the love of our country, it may be because of the November 5th election, but because of tariffs, they're going to be coming in. They're building already. Just about all of them have started. They're building their plants in all states all over the country, and they're building incredible pharmaceutical plants. We're going to have close to 100% of our pharmaceuticals in a very short period of time made in the USA. As part of these agreements, Merck will also donate 3.5 tons of antibacterials to be placed in America's strategic reserve. Thank you very much. GSX will donate over 200 pounds of ingredients to make rescue inhalers, which is a big deal, and Bristol Myers Squibb will donate 6.5 tons of blood thinners. We appreciate it. Such amazing companies. Every president for a generation has promised to reduce drug prices, but they were talking about a little bit like that. I am the only one of them to ever even think in terms of favored nations, and that's what this is. Favored nations. It's called most favored nation. We are now a most favored nation. I want to thank the leaders in the room, and I also want to thank the leaders of all of the countries that had to pay a little more so that we were treated fairly. I really do. I want to thank the leaders of countries. And they knew the alternative was not much of an alternative, because if they didn't do it, we were going to charge them tariffs, and the tariffs would have been much more severe than what they did. But they did do it as soon as they realized about the tariffs. Then they did it very easily. No, they're very good people. Let's start with Amgen's Executive Vice President, who I already introduced, and I introduced the people here. So I'd like to ask Bobby and Oz to say a few words, and also I'd like to ask if anybody would like to speak on behalf of your company, or just say how great this country is doing, and you're all building tremendous facilities now in the United States instead of other countries that we all know about. But if you'd like to say something. So, Oz, you want to start? And Bobby?